Chapter 11 Aminoglycosides. Chapter 11 Aminoglycosides. Aminoglycosides are a group of natural and semi-synthetic antibiotics discovered because of systematic research for drug-active against gram-negative organisms. Routine screening of soil microbes streptomyces led to discovery of streptomycin in 1944 by Waxman. These are antibiotics with amino sugar joined by glycosidic linkage. They are derived from soil actinomycetes of the genus Streptomyces, streptomycin, kanamycin, topramycin, neomycin, and the genus Micromonosperma, gentamicin, and sisomycin. Hence the difference in spelling. Amikacin and natrilamycin are semi-synthetic products. Streptomycin was highly important because of their activity against tubercle bacilli. Gentamicin derived from Micromonospora purpurea. Aminoglycoside, amino sugar joined by a glycosidic linkage. Aminocyclitose. Amino group is one cyclitol rather than sugar ring. Example: spectinomycin, apramycin. Aminoglycosides are relatively broad spectrum in terms of type of microorganism active against bacteria, mycoplasma, and mycobacteria. Bactericidal with activity against gram-negative aerobe newer group greater than active against Pseudomonas. Common properties. These are polycationic carbohydrate containing amino sugar in glycosidic linkage, highly water soluble polar compound. Presence of pus and tissue debris lead to loss of activity, not absorbed orally as they ionize in solution. Therefore, they are all given parentally. They remain extracellularly and penetration into CSF is very poor. More active at alkaline pH. All are bactericidal. They act by inhibiting protein synthesis in bacteria, mainly effective against G-negative organisms, gram-negative organisms, available as water-soluble sulfate salts stable in solution. Predominantly gram-negative activity, not active against anaerobe. Excreted unchanged in urine. Narrow margin of safety. At cranial nerve toxicity, ototoxicity, and nephrotoxicity are common even with new member. Readily developed resistance cross resistance is incomplete. Classification based on antibacterial spectrum. Narrow spectrum. Streptomycin and dihydrostreptomycin mainly active against aerobic gram-negative bacteria E. coli, Salmonella, Pasteurella species, Brucella species, and against Streptococci, Actinomyces bovis, and Leptospira species. Mycobacterium tuberculosis is sensitive to streptomycin. Extend spectrum neomycin, premicetin, promomycin, and kanamycin. They have broader spectrum than streptomycin and effective against both aerobic gram-negative bacteria as well as other gram-positive bacteria. They are clinically most useful against gram-negative infections caused by E. coli, Salmonella, Klebsiella, and Enterobacter. Broad spectrum, gentamicin, topramycin, amikacin, sisomycin, and natrilamycin. Highly effective against a wide variety of aerobic, both gram-positive and gram-negative bacteria, including Pseudomonas aeruginosa. Gentamicin is more potent than streptomycin, but it is ineffective against Mycobacterium tuberculosis. Amikacin and natrilamycin are resistant to bacterial aminoglycoside inactivating enzyme and therefore have widest spectrum of activity, including against organisms resistant to other aminoglycosides. Miscellaneous Apramycin and streptomycin. These drugs are structurally somewhat different from typical aminoglycosides but have similar antibacterial spectra and mechanism of action. Sources: streptomycin, Streptomyces griseus, neomycin, Streptomyces freddi, kanamycin, Streptomyces kanamyceticus, gentamicin, Micromonospora purpurea, tobramycin, Streptomyces tenebrarius, amikacin, semi-synthetic derivative of kanamycin, Sisomycin, Micromonospora inyoensis, Natilimycin, semi-synthetic derivative of Sisomycin, Fremicetin, Streptomyces lavandulae. Mechanism of action. Aminoglycosides, being water-soluble, penetrate the bacterial cell membrane through aqueous pore and reach the periplasmic space. They are taken up and transported across the cell membrane into the cytoplasm by an oxygen-dependent active transport process. It is observed that aminoglycosides disrupt the bacterial cell membrane, and this allows penetration of the drug into the bacterium from the periplasmic space. Inside the cell, aminoglycosides bind to 30S ribosome and inhibit bacterial protein synthesis. Block initiation of protein synthesis cause termination of protein synthesis and cause addition of incorrect amino acid, resulting in the synthesis of abnormal protein. Aminoglycosides are bactericidal. Higher the concentration, greater is the bactericidal effect, dose-dependent killing. A residual bactericidal effect, post-antibiotic effect, remain even after the plasma level of aminoglycoside fall. Hence, even though they have short T-half, they can be given once a day. Aminoglycoside penetrate cell membrane through aqueous pore, reach periplasmic space, bind 30S ribosome, inhibit of protein synthesis, bacterial effect. Mechanism of action of aminoglycoside. Low extracellular pH and aerobic environment inhibit the uptake of aminoglycosides by active transport because this is an oxygen-dependent process. Hence, aminoglycosides are not effective against anaerobic infection. Drug acting on cell wall like penicillin counter this negative effect of low pH and anaerobiasis and improve penetration. Biphasic mode of killing. Killing is biphasic: initial rapid killing followed by late slow killing. Those that survive initial killing become resistant to late phase because of decrease in permeability. Administration of antibiotic during refractory period enhances toxicity. Resistance. Aminoglycoside inactivating enzyme. On binding to aminoglycoside, the enzyme inactivates aminoglycosides which fail to bind the target ribosome. Low affinity of ribosome acquired by mutation, decrease in permeability to the antibiotic. There is partially cross resistance among various aminoglycosides. Pharmacokinetics. Poor oral absorption, hence only parenteral well distributed in extracellular fluid but does not cross the barriers. Low volume of distribution. T-half is short, 1-2 hours only. Excreted and changed in urine, bind to renal cortex. Drug interaction. Aminoglycoside plus beta-lactam additive effect. Oral aminoglycoside plus sulfa enteritis. enteritis. Toxicity. The aminoglycoside produce toxic effect which are common to all but the relative intensity may differ. The main toxicities are autotoxicity. Autotoxicity. This is the most important dose and duration of treatment related adverse effects. The autotoxicity involves progressive and irreversible damage to and destruction of the sensory cell in the cloaca and vestibular apparatus of the internal ear. Vestibular damage leads nystagmus, vertigo, and ataxia. Cochlear damage causes auditory disturbance, which may even lead to deafness. Concomitant administration of other autotoxic drugs potentiate the autotoxicity of aminoglycoside. Cats are particularly sensitive to vestibular toxicity. Streptomycin and gentamicin are more prone to produce vestibular toxicity, whereas neomycin and amikacin cause mainly cochlear damage. Natilmycin is less autotoxic and therefore preferred for long-term usage. Nephrotoxicity. Nephrotoxicity due to damage of kidney tubules, and this is more common in patients with pre-existing kidney disease. Renal damage can be reversed by immediate discontinuation of the drug. Neuromuscular blockage. High dose of aminoglycoside may cause neuromuscular block due to chelation of calcium and reduction of acetylcholine released from the motor nerve ending by aminoglycoside, resulting in skeletal muscle paralysis and respiratory arrest, which may even lead to death. Neomycin and streptomycin are more prone to cause this toxic effect than kanamycin, gentamicin, or amikacin. Topramycin is less toxic in this respect. The block can be partially antagonized by IV calcium glutamate and neostigmine. Hypersensitivity reaction. Hypersensitivity reaction, contact dermatitis, and sometimes allergic reaction, particularly to streptomycin in common. Rapid IV injection at high dosage may cause CNS disturbance, even convulsions, respiratory arrest, fall in BP, collapse, and death. Because of renal binding, they are not approved in food-producing animals. Accession dihydrostreptomycin, pre-slaughter withdrawal time 30 days. To reduce pain, local anesthetic may be added. Long-acting aminoglycoside, lignocaine or procaine, greater than not for IV. Buffered with magnesium ion complex, chelating property used to identify tumor. Fluorescence, delayed healing of fractured bone. Yellow discoloration of teeth, not to be given in pregnancy. Precaution in using aminoglycosides. Avoid concurrent use of other toxic drugs like loop diuretics. Avoid concurrent use of other nephrotoxic drugs like amphotericin B, cephalothin, and cisplatin. Avoid concurrent use of curare-mimetic drugs. To be used causally in elderly, in renal dysfunction, and in combination with skeletal muscle relaxant. Contraindicated in pregnancy due to risk of deafness in child. Do not mix aminoglycoside with other drugs in same syringe. Determination of plasma level of aminoglycoside may be needed in severe infections and in patients with renal dysfunction. Neomycin. Mixture of neomycin band C, source streptomyces freddi. Chemistry. white or yellow crystalline powder soluble in water and most stable, restricted to local use because of toxicity. Antimicrobial activity good for Staphylococcus aureus and low for other gram-positive bacteria. Gram-negative organisms susceptible including Pseudomonas. Kinetics PK absorbed well after parenteral administration IMIP. Distributed well crosses blood-brain barrier. Low absorption after oral administration. Excreted through kidney. Resistance plasmin mediated. Common in enteric commensal and pathogens. Drug interaction synergistic with beta-lactam and bacitracin. Clinical application reversed for local use. Coliform enteritis, urinary infection, skin, eye and ear infections. Topical neomycin sulfate plus bacitracin solution for wound dressing, eye and ear infection. Dry cow treatment along with penicillin G superior to streptopenicillin combination, occasionally combined with fungicidal compounds. Adverse effect routine addition of neomycin to milk powder of neonatal calves, increased frequency of diarrhea due to suppression of initial microflora or irritant effective on mucosa. Routine intrauterine administration of neomycin bolus to parturient cow increase the number of cervix per conception. Kanamycin, streptomycin, kanamyceticus, similar to neomycin but inactive against Pseudomonas. Larger therapeutic index treatment along with penicillin for Pasteurella pneumonia. Immediate treatment of Staphylococcus aureus, Mycoplasma bovis, subconjunctival route. Its use is replaced by gentamicin because of wider spectrum of activities. Gentamicin, fermentation product of Monosporium purpura, antimicrobial activity. The most active compound of the aminoglycoside. Broadest spectrum of activity, gram-negative rod including Pseudomonas enterobacteriaceae, many gram-positive bacteria including beta-hemolytic streptococcus, mycoplasma known against anaerobe, bactericidal and penetrate phagocyte cell poorly. Resistance depend on usage. Gentamicin resistant strains are resistant to other aminoglycosides but resistant Pseudomonas are susceptible to amikacin or topramycin. Pharmacokinetic profile activity is more in alkaline pH. Oral absorption is low. Little drug enters CSF, prostate and eye. Excreted through kidney, accumulates in kidney. Drug interaction combination with beta-lactam effective against gram positive and gram negative infections. Combination with potentiated sulfonamide effective against E. coli and Klebsiella infection. Antagonism carbanicillin and gentamicin incompletable in vitro. Clinical application enterobacteriaceae and Pseudomonas infection, respiratory tract infection, urinary tract infection, soft tissue infection, infection of eye and ear. Local application poultry monthly day old pearls for prevention and treatment of E. coli, Pseudomonas and Salmonella infection. Toxicity major effect neuromuscular block, ototoxicity, nephrotoxicity, indirect toxicity, exacerbated by diuretics, cephalosporin, amphotericin, proteinuria and renal cascade. Loss in vestibular function occur prior to nephrotoxicity. Therapeutic dose is safe. In some cases, respiratory paralysis may occur due to neuromuscular blockage. Tobramycin, source streptomycin tenebraeus, naturally occurring deoxykanamycin, similar to gentamicin in antimicrobial and Kinetic properties. More active against Pseudomonas when combined with anti-pseudomonal penicillin 4 times more active than gentamicin. Gentamicin resistant Enterobacteriaceae are resistant to tobramycin. Advantage: reduced nephrotoxicity compared to gentamicin. Cysomycin derivative of gentamicin, greater activity to Pseudomonas protease Klebsiella serratia, incomplete cross-resistance with gentamicin and tobramycin. Toxicity is identical to gentamicin. Natilmycin derivative of cysomycin, similar activity like gentamicin. Gentamicin resistant strain like E. coli, Klebsiella and serratia are susceptible to natilmycin but not Pseudomonas. Cysomycin and natilmycin not much used because of fewer advantages than amikacin. Amikacin derivative of kanamycin, more active than kanamycin but less than gentamicin and tobramycin. Resistant to enzyme that break down gentamicin and tobramycin. Amikacin greater than tobramycin is equal to gentamicin, greater than neomycin is equal to kanamycin, greater than streptomycin. Treatment of serious Pseudomonas infection and gram-negative infection in immunosuppressor human. Drug interaction synergistic with beta-lactam, especially for Pseudomonas. Clinical application for gram-negative septicemia caused by resistant gram-negative aerobes, toxicity, nephrotoxicity and ototoxicity but comparatively low. Paramycin sorts Streptomyces remisus, reserved for local application in food animal, parenterally for bovine respiratory disease. Aminocyclitols spectinomycin sorts Streptomyces spectabilis, like most of the toxic effect of aminoglycosides but limited use because of ready development of resistance. Mechanism of action: bind to 30S ribosome and present elongation of the polypeptide chain at the translocation steps. Antimicrobial activity, usually bacteriostatic but bactericidal at higher concentration. Limited gram-positive activity, better of gram-negative activity. Mycoplasma are sensitive, Pseudomonas are resistant. Natural resistance in many enteric bacteria is widespread. Plasmid-mediated resistance uncommon. Chromosomal one-step mutation to high-level resistance is common, similar to streptomycin but not show cross-resistance with aminoglycosides. Mild additive effect with lincosamide, useful in Mycoplasma treponema infection. Clinical uses: human not used, resistance, veterinary Mycoplasma enterobacteriaceae, respiratory tract infection, cattle, shipping fever, pneumonia, cow, Mycobacterium bovis, pneumonia, arthritis, swine, colibacillosis, respiratory disease, dog, gram-positive infection, poultry, chronic respiratory disease, infectious synovitis, salmonellosis, pasteurellosis. Toxicity: relatively monotoxic, does not induce ototoxicity and nephrotoxicity but cause neuromuscular block. Thank you.